So my name is Ryan Lee, and I'm a transplant hepatologist at University of Southern California. So I'm joined here by Liz Lee from University of Toronto to discuss her review article, Epidemiology and Trends of Alcohol Use Disorder and Alcohol-Associated Liver Disease. So thank you so much for joining us, Liz.
Thanks, Brian. Thanks for having me.
So tell us about your article. Really, who is it geared towards and what can they learn from it?
Well, this article is geared towards any clinicians that are involved in the care of people with alcohol use disorder and alcohol-associated liver disease. And I think it's really meant towards a liver provider. And I think what we hope that we're able to get from this article is really appreciation of some of the trends and epidemiology of alcohol use disorder and alcohol-associated liver disease. And what are some of the things that we can do as clinicians to be able to provide impact to our patients.
And so tell us then, so how have trends in alcohol use disorder and liver disease changed over time?
So I think it comes as no surprise. I don't think that there was a lot of earth-shattering data here, but I think some of the things that we really appreciate is that definitely alcohol use disorder admissions in the ED as well as in the hospitals is on the rise. I think what was probably the most relevant is that we are seeing that young people are disproportionately affected as well as women. We also saw that there was an increase in the use of alcohol excessively, as well as alcohol sales during the COVID-19 pandemic. And that has also led to a significant increase in hospitalizations related to alcohol-associated liver disease, as well as alcohol use disorder.
And that's definitely something I'm seeing in my practice, especially, you mentioned young people and women. Why are we seeing these trends?
Well, I think that that's definitely something that we're trying to think a little bit more about. And I think some of the things that we've reflected on, I think are probably relevant and true, is probably related to the way alcohol is normalized in social norms and social settings, and particularly with this young cohort. I think that this is also a cohort of people that was disproportionately affected during the pandemic, economically, also from a mental health perspective, and turned to substance use as a way of coping with mental health, as well as a lot of implications economically also as well. I think a lot of it also is related to branding. I think that there also are a lot of alcohol sales that are branded and marketed towards young people as well as women.
And so what do you think the medical community can do to address these trends? I mean, they sound concerning.
Yeah, I think on an individual level, for us as liver providers, I think it for us is about being able to build capacity to be able to support these individuals when you're seeing them in your practices. So even having increased capacity to be able to support addictions care, either through prescribing pharmacological therapies, being familiarized with them, being a consultant and collaborating with your substance use specialists in your hospital settings. I think these are all things that can be very helpful. Also, I think from a broader level, being able to advocate for funding for research or being participants in research to really help with supporting the data, to really help with driving policy change.
Yeah, it sounds like a lot of important initiatives to be done for this population in this article. What do you think the take-home message is for our readers?
Yeah, so I think that some of the take-home messages for our readers, aside from the not so surprising data related to alcohol use disorder and alcohol-associated liver disease, I think it's really related to being aware of the issues, being able to build capacity individually, but also collaborate with your multidisciplinary providers, participate in research, and drive policy.
Okay, great. So that was a lot of important information, and thank you for sharing all this knowledge with us. You can read more online with the full article, Epidemiology and Trends of Alcohol Use Disorder and Alcohol-Associated Liver Disease in Clinical Liver Disease.
All right, great. Thank you so much. Thank you.